dear learners, in this initiative, in this module, you will learn about initiatives at international level for health and well-being. Myself, Dr. Netanand Sahu, Department of Geography, Delhi School of Economics, University of Delhi. In this study module, learners will learn like how the international initiative has been taken for different types of health and well-being concepts. So, like for example, in this the outline of the study is like how to defining the health and well-being, then global significance of health and well-being, global health challenges, global health initiatives, regional health initiatives, and case studies, summary and conclusion with references also. Learners will know like understanding the key health concepts. They will also understand the insights into the global health challenges and also knowledge of the international health initiatives, awareness of regional health initiatives, grasp of thematic health initiatives, and also comprehended role of geography in health and also real world applications through case studies. Future trends and emerging challenges in global health. So, introduction to health and well-being. Definition by World Health Organization: a state of complete physical, mental and social well-being, not merely the absence of disease or infirmity. Holistic approach emphasizes the interconnectedness of physical, mental and social aspects of health. What is well-being? A broad concept like encompasses more than just health, includes happiness, life satisfaction and quality of life. What are the dimensions of well-being? Like physical, emotion, social, economic and environmental well-being. So, what are the global significance? Like global significance key to achieving sustainable development goals, especially SDG 3 like good health and well-being, integral to economic stability and social cohesion and overall development at the international level. This interconnections with geography, for example, like geographical factors, location, climate, environment play a critical role in determining health outcomes and overall well-being. Infectious disease, global health challenges, for example, ongoing challenges with disease like HIV, AIDS, tuberculosis, malaria and COVID-19. Geographic variation in disease prevalence, especially in low and middle income countries, for example, Sub-Saharan Africa and for malaria, and emerging infectious disease like zoonotic disease influenced by geography, for example, Ebola, Zika virus. Then like non-communicable disease, like rising burden of non-communicable disease, for example, cardiovascular disease and diabetes, cancer, chronic respiratory disease, and these are like global initiatives also, like geographical factors, for example, life expectancy, environmental factors including urbanization, pollution and climate. Then health inequalities and access to health care. Geographic disparities in the healthcare access, particularly in the rural versus urban areas, lack of access to the basic health services, sanitation and clean water in certain regions, for example, parts of Africa and South Asia. Then economic barriers in low income countries and affecting the health services availability. So, in this module also you will learn like global malnutrition problem, like undernutrition like impacting the children in developing countries, for example, Africa, South Asia, and also leading to the stunting and poor developments. So, then also in obesity, a growing concern in both developed and developing countries driven by the urbanization and change in the diet and lifestyle. So, global health challenges, for example, climate change and health, and impact of climate change on health, extreme weather events, heat waves, rising sea level, food insecurity and vulnerable geographical regions, in this case like coastal areas, low-lying islands and tropical regions. So, also another problem is migration and refugee. So, the like health, for example, challenges faced by the refugees and displaced populations, like in the geographical concentrations of different displaced populations in the conflict zones, for example, Middle East and Africa, we have still like problems in the war zones and also the strain of the local health systems. So, then another factor which is very important, aging populations, like global demographic shifts towards an aging population, especially in the regions like Europe, Japan and North America. So, like geographical implications for aging, like health infrastructures, healthcare needs and support systems for this elderly is it should be taken care of. So, then another problem is very serious is mental health crisis, rising global concerns for mental health disorder, for example depression, anxiety, and what are the geographical factors like impact of conflict zones, urbanizations and cultural stigma around mental health. Then global health initiatives like WHO's global health initiative, they have like World Health Organizations, the leading international body for global health, how WHO coordinates like different countries and they have specific like health policies, sets norms and provides technical support to countries, various countries of the world. Then global health initiative like communicable disease programs to combat HIV AIDS, tuberculosis, malaria and recent focus on COVID-19. Non-communicable disease like initiative addressing the cardiovascular disease, cancer, diabetes and respiratory conditions. Then immunization programs, for example vaccine initiatives to prevent disease like polio, measles and hepatitis and health emergency and the preparedness, for example WHO international health regulations framework for preventing and responding to global health crisis. For example, we can have a primary health center, for example, support for strengthening health systems especially low and middle income countries. And what are the geographical focus? The tailored program for regions like specific challenges, for example Africa, Southeast Asia, Sub-Saharan Africa and all this, like WHO initiatives aim to promote equitable health outcomes worldwide, accounting for geographical difference in the health needs. So, like introduction to the sustainable development goals, for example sustainable development goals focus on SDG 3 like good health and well-being, part of the United Nations 2030 agenda sustainable development goals, a set of 13 goals addressing global challenges like poverty, inequality and environmental sustainability, and also like SDG 3 that is good health and well-being. So, aims to ensure healthy lives and promote well-being for at all the ages of different countries, like targets including reducing maternal and child mortality, combating communicable disease and improving mental health and with specific focus to low developed countries. So, key indicators like universal health coverage, access to the essential medicines and vaccinations, reducing premature mortality from like non-communicable disease and addressing substance abuses. Like for example geographical focus, if you see, now prioritize the regions with significant health disparities such as Sub-Saharan Africa and South Asia. Okay. So, addresses health inequalities influenced by geography, for example rural and urban, low income and high income. So, like that have disparities. So, then global partnership like collaborations among countries, NGOs and private sectors to achieve sustainable development 3. Okay. The definition of like universal health coverage, for example ensuring that all the people have access to the health services they need without financial hardship, and this includes like access to promotive, preventive, curative, rehabilitative and palliative health services. So, like core components, for example health services access like equitable availability of health care for all populations, and financial protection, for example preventing individual from suffering financial like ruin due to medical expenses. So, for this matter, like for example you can say global importance, for example key target under SDG 3 good health and well-being, essentials for reducing poverty and achieving health equity, that is also the focus. And within this the geographical disparities, for example low and middle income countries face challenges in providing like universal health facilities due to the resource limitations, and geographical barriers such as rural and remote locations limit health care access. Then international initiative like WHO and World Bank monitor progress towards like UHC globally to focus the vulnerable regions like Sub-Saharan Africa and Southeast Asia. Then we have global also vaccine initiatives like global importance of vaccinations. Vaccination like prevent millions of deaths annually by protecting against disease like measles, polio and influenza, especially for the preventive outbreaks and also building herd immunity. So, like we have seen in the COVID-19. Then Gavi, the vaccine alliance like public private partnership aimed at the increasing access to the vaccinations in the low income countries, focus on improving vaccine equity and distribution in the underdeserved regions. Then we have like co-vaccine initiatives, like when global effort co-led by WHO, Gavi and CEPI to ensure equitable access to COVID-19 vaccines worldwide, prioritize vulnerable populations and low resource countries. At that time also we have seen like India also help other countries to spread this vaccines. Geographical factors, for example, targeted regions with low vaccination rates, especially sub-Saharan Africa and parts of Asia, addressed logistic challenges in remote and rural areas. Okay. Then we have problems of like in a global problem, polio eradication. Global polio eradication initiatives has made significant progress with a focus on the last remaining endemic countries, for example Afghanistan, Pakistan, and we have also global fund to fight AIDS, tuberculosis and malaria, introduction to the global fund. A global partnership between government, civil society and the private sector to accelerate the fight against AIDS, tuberculosis and also malaria. Like African countries, fight against AIDS is very serious concern is there, established by 2002 to improve the outcomes and reduce the global burdens of these disease. What are the key objectives? Like for example AIDS and HIV and AIDS, scaling of access to the antiretroviral therapy and prevention programs. So like tuberculosis, for example, focus on high burden countries to reduce tuberculosis transmissions and improve treatment outcomes. Then malaria, for example, supporting preventive measures like insecticides, treated bed nets and treatment access. Then we have like what are the purpose for this, like international health regulations, for example a legal binding international agreement coordinated by the WHO and basically this aims to prevent and respond to the global public health risk while avoiding unnecessary interference with international trade and travel. Then what are the core functions, like surveillance and reporting, requires countries to detect, access, report and respond to the public health. Emergencies of international concerns like preparedness, for example, and also response, establish a framework for managing pandemics. We have seen during the COVID-19 pandemic. So all these countries have like lockdowns and different initiatives they have taken and other health threats. Then health emergencies used like during global outbreaks like COVID-19, Ebola and Zika virus. Facilitates like rapid international collaborations and resource sharing. So about like we can have a regional health initiative PAHO, which is known as Pan American Health Organization. So what is basically established in 1902, PAHO is an international public health agency working to improve the health and well-being in the Americas. Acts as the regional office for the World Health Organization in the Americas. So what are the key objectives? Like promote universal health coverage, disease prevention and health systems strengthening across the region. So basically it addresses the regional health priorities like communicable and non-communicable disease, maternal and child health and also nutrition and also other health initiatives like for example vaccination programs. PAHO has been instrumental in eradicating disease like smallpox and polio in America. So then disease control like supports to efforts to combat disease such as dengue, Zika and COVID-19. What are the geographic focus? Works in Latin America, the Caribbean and other parts of the America targeted vulnerable populations and addressing health disparities. So then European Center for Disease Prevention and Control. So established in 2005, this ECDC is an European Union agency aimed at strengthening Europe's defense against infectious disease. So which monitors and analyze emerging health threats including outbreaks like influenza and COVID-19 and antimicrobial resistance, provides scientific advice, risk assessments and response coordinations across European Union member states. Similarly, we have like geographical focus within the Europe. ECDC's geographic focus primarily covers 27 European member states. So collaborates like European Economic Area countries, Iceland, Liechtenstein and also Norway, for example. So then provides epidemiological informations and also works with candidate and neighboring countries to strengthen disease prevention and control. Like Africa CDC and health initiatives about Africa CDC, like established in 2017 as a specialized health agency of the African Union. So, supports like member states in the responding to health rises and also like strengthening public health institutions. So, during different period and time also different countries come together for this type of collaborations, focus on disease surveillance, research and emergency preparedness across the continents. Key health programs like Africa Task Force for Coronavirus like coordinates COVID-19 response efforts. For example, Africa against COVID-19 vaccine rollout and equitable distributions initiatives like antimicrobial resistance, for example, programs for monitors and mitigates drug resistance infections. Then Africa CDC Institute for Pathogen Genomics like advanced genomic research to track infectious disease. So, basically geographical challenges whatever they are is like limited healthcare infrastructure in remote and rural areas and diverse healthcare capacities across 55 member states. Then Eastern Mediterranean Health Strategy like WHO EMRO's initiative like Eastern Mediterranean Health Strategy Initiative like the World Health Organization's Eastern Mediterranean Regional Office focus on improving health systems in 22 countries. So, this is basically health emergency programs provide support for conflict affected areas and rapid response to disease outbreaks like cholera and polio. So, universal health coverage like promotes equitable access to the healthcare service especially for underdeserved and various other targeted populations. Non-communicable disease programs like tackle rising rates of diabetes, cardiovascular disease and also cancer. So, this is like maternal and also child health, for example, strengthens reproductive health services and children immunizations like programs, they improve the immunity among the children. Then geographical considerations and impacts like covers diverse regions like Middle East, North America, Horn of Africa and Central Asia. Then conflict zones like for example Syria, Yemen challenges health initiative due to instability and also like infrastructure damages because of this war. Then cross border migrations and refugee movements create additional healthcare problems and also healthcare needs and strain local systems. So, arid climate and water scarcity impact disease control particularly in the areas prone to outbreaks, for example diarrheal disease and the Western specific regional health initiatives like key health strategy and programs. WHO Western specific regional office focus on the 37 countries and areas like universal health coverage within this like aims to provide equitable access to quality health services. Then communicable disease addresses like disease like tuberculosis, HIV and vector-borne diseases, malaria and dengue for example are like then within non-communicable disease like promote prevention and management of diabetes, heart disease and cancers. So, then also health security for example enhance preparedness and response to the health emergency including pandemics like also COVID-19. So, then environmental health like focus on the climate change, water sanitation and air pollutions. Then what are the geographic diversity and challenges? It includes like health diverse areas, highly diverse areas, island nations for example Fiji, large countries for example China and densely populated regions for example Japan and Philippines. So, challenges include geographic isolations and limited healthcare infrastructure in remote islands and also disaster prone areas such as typhoons, earthquakes and varied healthcare systems and economic disparities across the region impact in the implementation of the health strategies. Then dear learners, you can see like non-communicable disease for example global initiatives targeted non-communicable disease like WHO Global Action Plan for Prevention and Control of Non-Communicable Disease focus on the reducing premature deaths from non-communicable disease like cardiovascular disease, diabetes, cancer by 25% by 2025. So, United Nations political declaration on non-communicable disease encourages member states to take action on the risk factors like tobacco, use of tobacco, alcohol, unhealthy diets and physical inactivity. Okay. So, Global Non-Communicable Disease Alliance for example engage governments and civil society and international organizations to coordinate efforts to prevention and treatment. So, basically they have given a framework convention on tobacco control, aim to reduce tobacco consumption, a major risk factor for many non-communicable diseases. So, WHO Heart's initiative supports countries in improving the cardiovascular health through better clinical practices. So, geographical trend and challenges like high income countries have well developed non-communicable disease management programs, but face increasing healthcare costs due to aging populations, burden on the systems, infrastructures. Low and middle income countries, particularly in Sub-Saharan Africa and South Asia, see rising non-communicable disease rates compounded by the limited access to the healthcare services. So, and also urbanization and changing lifestyle in developing regions contribute to increased non-communicable disease prevalences. So, many regions face challenges in addressing non-communicable disease due to limited health infrastructure and economic inadequate public awareness. Dear learners, also there is another problem like mental health initiatives. Like international focus on mental health, like WHO Mental Health Action Plan 2013-2030 aims to promote mental well-being, preventive disorders and provide access to quality care globally. So, this is like mental health gap action programs which focuses on the scaling of services for mental, neurological, substance use disorder, particularly in low and middle income countries. So, for United for Global Mental Health, advocates for increased funding and prioritizing of mental health in global and national health agenda. So, almost all the countries should put that in their national agenda. So, United Nations Sustainable Development Goals like mental health is included within the SDG 3, good health and well-being, targeted mental health as a part of the universal health coverage. Then this learners you can see Global Mental Health Day raises awareness and combats stigma around mental health issues. So, and geographical disparities for this is geographical disparities in access and treatment. So, high income countries tend to have better mental health care infrastructures with access to service, trained professionals and support systems, but low and middle income countries often face severe shortage in mental health service practitioners with few facilities and mental health professionals per capita very less. So, then infectious disease control global initiative for controlling infectious disease. So, global security agenda, for example, global health security agenda focuses on the strengthening capacities to prevent, detect and respond to infectious disease threats worldwide. So, this is basically WHO International Health Regulations, a legal binding framework for preventing and controlling different types of cross-border disease outbreaks. So, for example, Gavi, the Vaccine Alliance, we have seen this COVID-19 time, how this vaccine alliances, support system, immunization programs to control vaccine preventive like disease like measles, polio and HPV. So, global fund to fight AIDS, tuberculosis and malaria finance programs to reduce the burden of these disease in low income countries. So, CDC global disease detection programs for example provides rapid response and outbreak surveillance to contain the infectious diseases globally. So, what is the geographical strategy and outcomes Sub-Saharan Africa focus on the malaria, HIV and tuberculosis control through vaccination treatment programs and bed net distributions with marked reduction in disease incidence. So, then Southeast Asia strategy include improving sanitations and vaccinations coverage to control the disease like dengue and cholera. So, then developed countries for example stronger healthcare systems focus on preparedness and rapid detection and containment of outbreak as seen during the COVID-19 pandemic. Then we have another factor, for example you can say climate change and health impact on climate on health outcomes like extreme weather events, increased frequency of heat waves, floods and storms lead to injuries, displacement and loss of life. So, vector-borne disease like rising temperature and changing rainfall patterns, erratic behavior of rainfall expand the habitats of disease mosquito, vector like mosquito increasing the spread of malaria, dengue and Zika virus. Then we have another serious problem learners like air pollution. Higher pollution levels contribute to respiratory and cardiovascular disease especially in the urban areas. food and water security like droughts and floods affect agricultural yields, leading to malnutrition and waterborne disease. Then also, dear learners, we have another problems like mental health. Displacement and loss due to climate disasters contribute to the stress, anxiety and depressions. Okay. We have seen the international migration because of war. So, international initiatives like addressing climate related health issues, WHO climate change and health program like works to enhance public health systems resilience to climate change impacts. So, Paris Agreement aims to limit global warming and reduce the health risk associated with climate change. Then Climate and Clean Air Coalition focuses on the reducing short-lived climate pollutants, for example methane, black carbon, to improve air quality and health. Then United Nations Sustainable Development Goals targets climate actions SDG 13 and good health SDG 3 and climate related health challenges. Nutrition and food security initiatives global program, for example targeting nutrition and food security. These are basically need for the low countries, sub-Saharan Africa. Then world food programs like we have provides emergency like work of nutrition and food security in vulnerable communities. For example, scaling of nutrition movement supports countries in implementing policies to reduce malnutrition, particularly among children and pregnant women. Then another very important program is like GAIN, Global Alliance for Improved Nutrition, focuses on fortifying staple foods and improving access to nutritious diets, especially in low income regions. For example, Food and Agriculture Organization FAO leads initiative to promote sustainable agriculture practices and combat hunger. Also like thematic, we have UNICEF, for example nutrition programs like addresses malnutrition through maternal and child nutrition interventions. Okay. Then we have including micronutrients and supplementation and also giving breastfeeding promotions like that is also in geographical impact and challenges. For example, sub-Saharan Africa faces severe food insecurity and malnutrition due to climate change, conflict and poverty, and with high rates of stunting in children. So, South Asia, home to a significant portion of the world's malnourished and also insecurity like populations with food insecurity exacerbated by population density and also poor infrastructure. Then we have also learners like conflict zones, war disrupt food productions and supply chains leading to acute hunger and malnutrition. Developed countries, food insecurity exists in the marginalized communities through obesity and poor nutrition are also growing concerns. We have case studies like for example case study 1 like COVID-19 pandemic. We have seen during the COVID-19 like how this WHO international organizations like different organizations started sharing the data, how to make the vaccine and how to do the testing, like provided guidelines for this testing, treatment and prevention like mask wearing, physical distancing, all this. Then COVAXIN initiative like aimed to ensure equitable distribution of COVID-19 vaccines, especially for the low income countries. Then we have also like during that period lockdown and travel restrictions, many countries implemented lockdowns and quarantines and also travel bans to slow virus transmissions. Also vaccine developments like rapid collaborations led to the development of multiple vaccines within a year with emergency due to authorized granted globally. So sharing of the data and global agreements, all this helped to distribution purpose also, like economic stimulus package. For example, governments provided financial support to the individuals and also business affected by lockdowns and economic downturns. So geographical disparities in health outcomes like high income countries faster access to vaccines and advanced healthcare systems contributed to the better outcomes through like initiatives. Outbreaks were severe like Europe and USA. Low income countries like faced delayed vaccine access, limited healthcare infrastructure and higher death rates. Remote and conflict affected regions struggled with testing vaccinations and also access to the medical supplies, exaggerates the impact of the virus. So variability in the healthcare systems, public health measures like political response resulted in a stark difference in the infection rates and fatalities globally. In this figure confirm that death due to COVID-19 is shown. In this figure you can see also case studies, and we have another case studies like malaria eradication. malaria eradication efforts, international initiatives to combat malaria like Rule Back Malaria Partnership, a global initiative aiming to reduce malaria deaths through preventions like treatment and advocacy. So, Global Fund to Fight AIDS like tuberculosis and malaria provides funding for malaria prevention and treatment programs in high burden countries. For example, we have like WHO, Global Malaria Program sets guidelines for malaria control, promotes research and supports countries in reducing transmissions. So, presidents like malaria initiatives like a US government's initiative that funds malaria control programs in endemic countries focusing on prevention through insecticides, treated nets and also indoor spraying. So, geographical focus on sub-Saharan countries, sub-Saharan Africa bears more or all over like 90% of the global malaria burden. So, African countries are most dangerous for this malaria, with children under 5 being most affected. Then key strategy like including widespread distribution of nets and rapid diagnostic testing and access to the artemisinin based combination therapy like ACTS therapy. So, then also geographical challenges include poor healthcare infrastructure, insecticides resistance and also difficulty reaching remote and rural populations. Despite progress, ongoing efforts are needed to reduce transmissions and mortality, especially in regions with persistent malaria hotspots. In this figure, learners, you can see also death related to malaria in the African region has been shown in this figure. Please have a look on this figure. Then case study, another case study addressing the obesity in the specific islands like regional health challenges. For example, specific islands have some of the highest obesity rates in the world, with countries like Nauru, Tonga and Samoa significantly affected. High consumption of processed imported foods, high in sugar, fat and salt has replaced traditional diets, contributing to rising obesity rates. The obesity is linked to increasing rates of non-communicable disease such as diabetes, heart disease and hypertension. Straining healthcare systems like limited access to the healthcare services and preventive programs exaggerates the situations, especially in remote island communities. Cultural factors such as the perceptions of large body size as a sign of wealth and healthy challenge public health campaigns, and geographical strategy for addressing obesity like regional initiative like the specific NCD roadmap and health islands vision focus on the promoting healthier lifestyle through improved diet and physical activities. So, let's have summarize this model like class. So, climate change like rising temperature and extreme weather events will exacerbate health risks including vector-borne disease, malnutrition and mental health issues. Then antimicrobial resistance, increasing resistance to antibiotics will complicate the treatment of infections, poisoning a significant global threat. Then aging populations like many countries, particularly in the high income regions, will face growing healthcare demands due to aging populations and rise of non-communicable disease. Then pandemic preparedness like COVID-19 highlighted the need for stronger global health systems to prevent and respond to future pandemics. Mental health crisis like as awareness grows, mental health challenges will require more robust global and local health care framework. So, we have many such things to do at the national level, international level and the organizations they are doing, and here also for the learners I have given many references, research articles, books and also websites where you can get the informations. And learners, I hope you have learned a lot how the global initiative and which regions and what type of initiative on which type of disease, and many things you have learned through this lecture. Thank you for listening.